All right, guys, we're going to get started. Hello, and thank you for joining us for our cold, COVID, and flu virtual roundtable discussion. I'm Courtney, part of the marketing department at Hill & Marks here, and we are thrilled to have experts from Clorox, ISSA, and GOJO present with us. We will save time at the end for any questions relevant to the conversation that we haven't answered. So please keep your microphones muted until that time. This discussion is being recorded, and it will be available to view later on today. And it is my pleasure to introduce our expert panel and have them tell you a little bit about themselves. So first we have Patty Ollinger, Executive Director of Global Biorisk Advisory Council from ISSA. We have Jordan Bastian, infection preventionist from Clorox, and Stephanie Schneider, Product Management VP and General Manager from GOJO. And Patty, if you want to start with an introduction.
Oh, well, thank you. First, I'd like to thank, Hill & Marks for having this wonderful roundtable. It is so important as we're going into the flu season. So hi, everybody. I'm Patty Ollinger. I'm the Executive Director of GBAC, the Global Biorisk Advisory Council. We're a division of ISSA, the world leading trade association for the cleaning industry. And it is my pleasure to be here today. And thank you.
Thank you, Patty. Jordan, if you'd like to give a little introduction about yourself.
Hi, everyone, and thanks for having me today. I'm excited to be here and talk about cold and flu, and that's something that's always on our mind this time of year. I'm Jordan Bastian. I am a senior infection preventionist with Clorox Professional, and I have my background's in epidemiology, infection control, and I'm board certified in infection control. And just excited to talk with you all today and to share some news and some things that are coming up.
Thank you so much. And Stephanie, if you would like to do your introduction.
Yeah, thanks, Courtney. And like the other panelists, really appreciate the opportunity to be part of the discussion today. As Courtney mentioned, I'm Stephanie Schneider from GOJO Industries. You may know us best as the inventors of Purell hand sanitizer. Our GOJO purpose is to save lives and make life better with well-being solutions, which I think is definitely a part of the topic that we're discussing today. As Courtney mentioned, I lead our product management team, and what that really means is our team is responsible for creating innovation, collaborating with R&D, regulatory, supply chain, marketing, and sales teams. And I've done this work for quite a long time at GOJO for 12 years and previous experiences at Rubbermaid and Procter & Gamble. So excited to be with you all today.
Thank you guys so much. Thank you. And thank you for being here and being part of this. And thank you to all of our guests. It is now time to get started. So without further ado, let's start with Stephanie. Stephanie, how are hand and surface hygiene products regulated?
Yeah, thanks so much, Courtney, and appreciate that we're starting our conversation talking about the two U.S. government regulatory bodies that regulate the two categories that I think we'll primarily be talking about today, hand hygiene products and surface products. Hand hygiene products are regulated by the U.S. Food and Drug Administration, so the FDA, and they regulate hand sanitizer as an over-the-counter drug. The U.S. Environmental Protection Agency, the EPA, regulates surface disinfectants to ensure that they're effective and safe for use by consumers. The EPA, unlike the FDA, allows for viral efficacy claims like influenza, COVID, and norovirus. The US FDA does not allow these types of claims by manufacturers of hand sanitizers and soap. And so you'll see the nuance probably in our conversation today in terms of the effectiveness of the products as we talk throughout the morning. And then the other thing I would just mention is during the height of the pandemic, the FDA, for the regulation of hand sanitizers, they issued a temporary guidance to help make sure that there was a supply of sanitizer available. But during that time, there was a variety of quality and performance hand sanitizers that came on the market, even some that were later deemed to be dangerous. This temporary guidance has now been withdrawn, but the FDA list of hand sanitizers to avoid continues to grow and is now nearly up to 400 brands. So I just wanted to make sure everybody here, you can see that list on the FDA website, just to make sure that anything you might be using, just to double check that it's not on that list. There was some new additions to that just as recent as 2 weeks ago.
Thank you so much. Thank you so much for that information. We're going to move on to Jordan now. Jordan, should we be worried about cold and flu this respiratory season?
Yeah, thanks, Courtney. That's a great question. It's a question I think is on a lot of our minds. I know as an infection preventionist, it was something that I was worried about as I was supporting clinics and healthcare facilities, wondering what are we going to see this coming flu season. So as we move into colder months, with winter right around the corner, we see people kind of move from their outdoor activities into these indoor gatherings, and that really creates a more of a chance of spread of these infectious germs and pathogens. And we know, from experience and maybe personal experience that flu and cold can really stop you in your tracks, and it can really lead to the spread and cause outbreaks, and that really disrupts schools, offices, and causes problems for our healthcare workers as well. So as we anticipate what's going to happen this cold and flu season, we turn to our friends in the Southern Hemisphere, Australia, and look at what they've seen. So look at their prior flu season, which just comes right before ours, and so they're just getting out of that. And according to Australia's Department of Health, they actually saw their worst flu season within the last 5 years, and this actually started 2 months earlier than normal, which is pretty unusual. So from that data, we anticipate that we might see a stronger flu season here in the U.S. as well. We're already seeing an uptick in some cases of flu starting in September, according to CDC's Flu View. So that paired with other respiratory pathogens, we could be seeing something higher in those regards, and that might be unusual. I think there's multiple factors that may contribute to our flu season this year, and one that I really want to touch on is the lessening and reduction of precautions that we've really been part of and taking, actively participating in the last couple of years. So these COVID-19 precautions really have lessened and kind of gone, I wouldn't say to the wayside, but they're not on the top of people's mind anymore, the focus. And so as we see people gathering back into schools, into office settings, as we're doing more in-person events, activities, conferences, and we're seeing more people gather together. We're also seeing more travel, both globally and domestically. That's people taking germs from their setting to another setting, as well as bringing things back. So we see more travel, more spread of germs that way. We're also seeing less masking in public settings, as well as social distancing. Additionally, hand hygiene and surface disinfection has been kind of less on people's mind as well. There was a lot of that happening. It wasn't uncommon to go to a grocery store and see people wiping down carts and wiping down these surfaces regularly. And I don't think we're quite seeing that as we used to. And so really, as we consider these things, now with these being lessened, there's a higher risk of exposure and risk to people, and that would cause these flu numbers to increase and the risk to be higher. So as we think about that, I think we need to take a holistic germ prevention approach or strategy. That includes cleaning and disinfection to make sure that we're keeping our surfaces and things clean, and we can move forward in a safe and healthy way.
Great, thank you so much, Jordan. Patty, as we head into our winter typical flu season, what do you see as important behaviors and work practices that we need to focus on?
Oh, well, Jordan really touched on a lot of it, and it's really those behaviors. There are a lot of things that we're not going to be in control of, how a facility maintains itself, but we can be in control of our hand hygiene. We can be in control of, if you're immunocompromised or have family members at home that are immunocompromised, wearing a mask to protect yourself so that you are not bringing it home to your family members. There's so much. What I didn't indicate earlier is, for many years of my career prior to joining ISSA, I was the head of environmental health and safety and led many environmental health and safety teams. And I am the current convener for ISO, for the development of international standards on biorisk management. And when we look at the importance of health and well-being, cleaning is at that hygiene is at that cornerstone. It is one of the fundamental things that we can do. So as we go into the winter months, as Jordan indicated, we're going inside, our kids are going back to school, we're touching all these surfaces and everything, that importance from a facility standpoint of cleaning and sanitizing those, especially those frequently touched points in areas within your facility, as well as hand hygiene and personal behaviors really need to be highlighted, because it will make a difference, for our protection against the flu, COVID, and other things as well.
Thank you so much. So Jordan, what types of respiratory pathogens can we expect to see in this upcoming cold and flu season?
Yeah, that's another great question. We tend to talk about it as a cold and flu season, and I like to think of it more as a respiratory season. I feel like that's more accurate and more accurately describes, because we're not only just seeing our typical cold and flu viruses, our influenza and our RSV, rhinovirus. These are expected, and I think we will see those things, but we're also seeing other things. We are still in the midst of COVID-19. We're going to continue to see SARS-CoV-2, which is becoming more endemic. And we'll also see new and re-emerging diseases. For example, enterovirus 68D is something that we're seeing rising in schools and in our pediatric population. So we really have a dual threat going on here. We have our typical as well as other pathogens, and the term that was coined during the pandemic, twindemic, and I think is more relevant to this year than it has been in past years, as we're seeing the lessened precautions and the relaxation of some of these things, that we're going to be faced with these multiple threats on our front that are going to impact us in our various settings as well as our communities. So I think it's important that we understand that this is very much important to focus on more of these respiratory pathogens than just a single focus. And that being said, I think it's important that we understand that pathogens all differ from the way that they are spread from one person to another, how long they live on surfaces, and their signs and symptoms even. And so at CloroxPro, we actually have a resource guide that talks about these different types of respiratory pathogens. We talk about RSV, COVID-19, cold, the rhinovirus, as well as influenza, and talks about the differences that we can find between these two. And so we can be properly educated, have the proper tools that we need to combat those multiple threats. Additionally, we know that germs can live on surfaces. We see that cold and flu can live from 2 hours to even 2 weeks on surfaces. So I think it's important that we take the steps to make sure that our surfaces are being cleaned. And when we know that not all these respiratory viruses have vaccines for them, they're not vaccine preventable, we really need to take a step back and look at what can we do to protect our environment where we pick up these pathogens, and where we can protect ourselves by performing this cleaning and disinfection as needed.
Thank you so much. So back to Patty. GBEC just hosted in August a symposium on the importance of indoor air quality and health environments. Can you share with us some of the lessons that you learned from the symposium?
Absolutely. One of the themes that came out was what gets measured gets managed. And I think that's a really important concept that we all have heard before, but what's coming out on the market now are some really nice. I wish when I was environmental health and safety and had those, industrial hygienists that reported to me and indoor air quality concerns, had some of these units that are now out there that look at particulates in the air, real-time numbers, volatile organic compounds, and CO2 levels. Because as populations are coming into a building, you're seeing some of these numbers come up, and that's when we can also see the need for your ventilation system to maybe go into a higher mode of air circulation, or having some spaces just cannot be retrofitted, and so having some of those portable units that actually clean the air, that will filter or treat the air, really is important to look at and to put in places where there's going to be a high capacity of individuals. That was one of the key things. The other thing is, over the last couple of years, the innovation that has come out on the market is just phenomenal. And I think that we've seen, as Stephanie had indicated with hand sanitizers, some snake oil out there. We have seen some amazing technologies that are now becoming more available to us, and at price points that people can afford.
Amazing. Thank you for sharing. Stephanie, what role do surfaces play in spreading the flu around a facility? What should a school or healthcare facility look for in a surface disinfectant? That's a little bit of a two-parter for you.
Yeah, thanks, Courtney. And I think, as Patty and Jordan have mentioned so far, with the anticipated winter season and flu season upon us, surfaces play a really important role for the transmission of germs. And, stopping that transmission of germs is really important. And, contaminated surfaces and equipment contribute to the spread of illness. The CDC says maintaining a clean environment and providing easy access to these hygiene products and supplies is one easy way to help prevent the spread of illness, like flu in schools or healthcare settings. I think the other thing we've talked so far is the frequency of cleaning those surfaces. We're not cleaning them as frequently as we have in the past 2 years. So that frequency of cleaning these high-touch surfaces is also an important consideration. But when you're thinking about what is the right products to use to enable kind of these clean surfaces, it can be a little challenging to choose the right product for your facility. Here's a few things to consider. Make sure that you're using an EPA-approved surface disinfectant. Check the label to make sure it's killing the viruses that your facility is concerned about, like what we're talking about today in terms of influenza A. Also, check how long the surface needs to remain visibly wet to kill the germs that you want to kill. That's known as contact time. Some products may take as long as 10 minutes to kill germs, so you want to make sure that it works for your facility and your cleaning protocols. And especially safety is of the utmost importance, both schools and healthcare settings. So read the label. Check if the product has any concerning signal phrases like dangers or warnings. The EPA also categorizes surface disinfectants from category 1, which is the most toxic or highly toxic, to category 4, which is low toxicity. If possible, select products rated as category 4 to reduce the risk of harm. Those with higher toxicity ratings frequently have caution statements like causes eye irritation or instructions to wash your hands after using. They also may require PPE or gloves to use while using. So just read the label and make sure you know what you're using and that it works best for your environment. And then ultimately you're looking for something that works. It has the efficacy and it's going to kill what you want it to kill during this winter season, and it has that low toxicity.
Amazing. Thank you so much. Jordan, what steps should we take to prevent the spread of cold and flu germs on surfaces and shared spaces in high traffic areas such as offices and schools? Stephanie touched on that a bit, but could you expand a little bit?
Yeah, sure can. So we know that these offices and schools, this is where we spend a lot of our time. We're in our offices, a bulk of the hours of the day. We send our kids to school. We want to make sure that these settings are safe for us to be spending our time in, and that the surfaces aren't going to be contaminated with these types of germs and pathogens. So I think it's important that we understand what needs to be done, and as Stephanie mentioned, making sure we have the right product, making sure that the frequency of cleaning and disinfection is happening. It's important that we use a broad spectrum cleaning disinfectant product. An example is Clorox disinfecting wipes. They can kill cold and flu in as little as 15 seconds. So making sure we have something at our disposal and making sure that we are put in the right place that we can protect ourselves and those who are going to be in these spaces, especially shared spaces. We see move from a traditional model of office spaces to more of these shared spaces where people share desks, they share common spaces, and so making sure that those can be cleaned in the right way. One of the things that we can do is to assess our space. If we're sitting in a work setting or in a conference room, look around. Do you have the cleaning disinfectant products you need? Do you have wipes available? Do you have those things? And if you don't, do you know where you can get them? Who to ask. It may be just a simple question, maybe to your facilities manager saying, I'm seeing that I don't have disinfectant wipes, or maybe it's tissues or hand sanitizer. Making sure that you have the right tools to be safe in your spaces. Also, we're seeing a rise, as I talked about a little bit earlier, is in our schools and our offices. People are coming back in person. Recent data showed that there's been an increase. In September alone, there was a 4-point increase. With an average of 47.5% of people being back in the office. That's the highest level since the beginning of the pandemic. So we're seeing more people. More people means more germs, more sharing, unfortunately. So we got to really make sure that we're doing our part. it's always important that we're courteous of others. We don't know someone's health situation, what their risks are. So especially when we're sharing these spaces with others, making sure that we're touching on these areas that may be a reservoir for these pathogens. So making sure we're cleaning and wiping these surfaces down after use. This could be our conference rooms, our break rooms, commonly touched objects around the office, including like a copy machine or maybe a computer station, making sure that those are cleaned after each use so that we can protect ourselves as well as we can protect those who are coming after us.
Amazing. Thank you so much. Stephanie, do you have anything to add as to how a school can ensure the cleanliness of surfaces within its facilities?
Yeah, I think Jordan touched on a lot of different things. I think the one thing I would also just add to what Jordan shared was just thinking about training your maintenance staff. So what kind of protocols do you want them doing? And do you want to change those protocols during this winter season? So the frequency at which you may want these high touch surfaces clean. The other consideration is sometimes the maintenance staff can't be everywhere all the time. And so are you relying on other people in the facility to clean those surfaces? And when you do that, are they properly trained and do they have the right things? So again, as you look at those labels and looking for something that's highly efficacious, and then if you're going to have other people participate in that frequent cleaning, making sure that you've got that low toxicity so that they can really balance that out and don't require a hand wash or PPE while using that product. The other thing that I think a lot of facilities had during the pandemic was your pandemic response plan. So probably good to take another look at those, because as you manage the illness through these winter months, you may just want to make sure that that all is up to date and accurate in terms of what you would do if you have any illness outbreaks in your facility. And then finally, it's a good time to check the inventory of your hygiene products, and then also make sure that you don't have anything that's been in the closet that's been expired since you purchased it. I know a lot of people bought a lot of inventory, so it's a good time of year to check and make sure that everything is within its expiry date.
Great, thank you so much. Patty, what trends and needs do you see in the area of hand hygiene?
Well, just to elaborate a little bit on what Jordan and Stephanie just said, I mean, I'm sitting here smiling because this is really what GBEC STAR, our facility accreditation program, was all about. Everything that they talked about was that reiteration from a facility standpoint to think about these things and put in place the program so that you're reassessing, reevaluating, and making sure that you have a scalable response in whatever it is necessary. So I was sitting here smiling the whole time as they were talking, because it really, whether it's STAR or you're putting in a program, a quality system where you're doing that whole plan, do, check, act, it's really important. With regard to hand hygiene, what we're seeing, as things are relaxing, if you remember during the pandemic, everybody kind of banned out their air hand dryers, and we didn't see them very often. And this is just an example. My last trip when I went when I went over to Chicago, every single place that I went into, their air dryers were back up and running. And I recently did some media spots with Fox News talking about, air dryers and the combination in between, or the comparison of air dryers and paper towels. And we know that hygienically, paper towels are more hygienic for multiple reasons. But from an economic standpoint, we also realize that right now businesses are really hurting, and businesses are hurting for people and financials. So you also see the impact on, people going to those restrooms and making sure that they're clean and sanitized and taking the waste out, and then also the cost of waste disposal. So you're starting to see the air dryers come back in place. And one of the key things I think is important is making sure that if you're going to be using those air dryers, make sure that they're maintained well, they get forgotten many, many times. And that's where you sometimes see that contamination, not necessarily from improperly washed hands, but even from the equipment itself. Also, if you're going to be using them, have that hand sanitizer really close by so that people can follow up with a hand sanitizer. That's one thing. But then also just the basics of teaching people. I mean, you would think that washing our hands is something that we would need, that is common sense, but it's not. And, you don't want us to be sitting there, washing your hands and singing the happy birthday song. But, we really need to start at little, young ages as how we maintain our hands, basically, and not touch our eyes, our nose, and our mouth. Hard to do, believe me.
Very, very. Stephanie, why is hand hygiene important during the winter season, and what should a school or healthcare facility look for in its hand hygiene products?
Yeah, thanks, Courtney. We've spent a lot of this morning talking about surface cleaning, and Patty just talked about the role of hand hygiene. And as we know from the World Health Organization and the CDC, they both agree and strongly promote and practicing good hand hygiene is an incredible, effective way to wash away or kill germs that may cause illness. So it's another important kind of thing we should do as we head into these winter months. It plays an important role in patient care and safety, especially in healthcare facilities, and has for many, many decades. In healthcare, they often call hand sanitizer as an alcohol-based hand rub. It is the go-to method for hand hygiene in healthcare settings. It's more effective. It's easier on the skin, especially for how often healthcare workers need to be cleaning and sanitizing their hands, taking care of patients. And it helps improve hand hygiene and reduce the spread of infections in hospital settings. So the efficacy of the hand sanitizer you choose is really important, and they're not all necessarily created equal. The quality of the product that you choose really does also reflect your school or your healthcare setting. So a few things to look for as you look at hand hygiene products in your facilities. Look for mild soaps that are moisturizing and have soothing ingredients to help soften and soothe the skin, because you don't want to strip away those nutrients and oils, especially during the cold winter months. Choose a quality hand sanitizer. Per the FDA monograph, you want to choose a hand sanitizer that's more than 60% ethyl alcohol or more than 70% isopropyl alcohol. And you want to choose something that's from a trusted brand that's safe and effective and pleasing to use. I think we all ran into those other kind of sanitizers during the pandemic, and you're like, gosh, that's not pleasing, right? And if something's not pleasing to use, it's certainly not going to encourage good hand hygiene practices over the next several months. And the last thing I would just mention is, again, during the pandemic, I think there was a lot more prevalence of bulk hand soap and hand sanitizer dispensers. These dispensers really pose a potential safety risk because you can inadvertently add germs to those dispensers, and then they're not doing their core job. Both the CDC and the FDA advise against kind of these bulk hand sanitizer and hand soap dispensers.
Thank you so much. And as a follow-up question, how can a school encourage their students and staff to have better hand hygiene, especially during these stormy winter months?
Yeah. So again, I think both Patty and Jordan have talked a little bit about this, but for school-age children, the importance of hand hygiene is so critically important. They're touching lots of things in that school environment. And certainly you can't get all of those surfaces clean. So again, you want to make sure you're choosing the right hand products. The other thing I would add to our conversation this morning is putting them in the right places. Where are the right places in the facility so people coming into the school, whether adults or children, have good access and they're at the right moment? So consider things about placing it at the entry and exit of the cafeteria. So before you're eating, a good time to clean your hands. Maybe before they're going in and out of certain environments where they're touching a lot of things like gym, right? When they might be touching a lot of shared objects. So putting it in the right place is really something to consider. And again, usage is driven by liking the product, trusting the brand, knowing the brand. That encourages more use. And then finally, for K through 12, check with your manufacturer. I know GOJO and the Purell brand offers this, but they offer interactive experiments and different kinds of things teachers can do with school-age children to help encourage hand washing.
That's awesome. Thank you so much. And Patty, ISSA just launched the Rethink Clean campaign. Can you discuss the importance of this campaign?
Oh, yes. And this is so exciting. This is actually something that we're doing that's really has been a lot of fun as well. So as you may know, the whole mantra of ISSA is changing the way the world views cleaning. And GOJO and Clorox are two of our major members that are there. And this whole campaign was really born out of our board of directors a year ago. They felt that when they started looking at the changing guidelines that were coming out of CDC and other, regulatory agencies and guidance agencies like WHO, as well as, the supply chain issues that they were seeing, they thought that we needed a got milk campaign. And this really is born out of that. So, our tagline is advancing clean and driving innovation. And so we wanted to come up with a campaign that really, it's not about ISSA, it's about our members, and it's about, changing that whole way people look at clean, recognizing that it really has a lot to do with health and hygiene and well-being. And timing is amazing, but the UN just came out with their new directive, and they declared that clean and healthy environments on July 28th is a universal human right. And with that, we're looking at how not only, how we clean, and you'll understand what that means when you see the videos, because Howie Mandel is our spokesperson for this. So how we clean, as well as, the validation of clean. And at the show next week, we're going to be rolling out our validation toolkit, and that's only going to grow. But it's really cleaning for health. And it's really around the air we breathe, the surfaces that we touch, and the water we drink. It is so important from an environmental health standpoint, and just a healthy space standpoint moving forward. And so that campaign, we're really enjoying it, and we see the amazing importance of it, and thank our members for all the support that they've given as well.
Thank you so much. Thank you all three of you. Thank you so much for being here and for presenting. We're going to open the floor now to any questions that we did not answer. So if there's any questions that anybody has, you can raise your hand or turn your camera on or put them in the chat, and we will, and our panel, please, and you can direct them at the person that you'd like to direct them at. We'll give some time for people to see if there's anything that they had that we didn't go through. All right, well, it seems like all of our questions have been answered. So I'd like each of our members of this panel to go through and do their closing remarks, and we will adjourn. So Stephanie, you can start off with closing remarks.
Yeah, thanks, Courtney. Again, just want to express my gratitude to be able to participate today and represent GOJO and the Purell brand. And I think really appreciate you putting this on to help educate all of us as we head into the next winter months. As Jordan mentioned, we do expect this to be maybe an unlike other years' flu season. And, remembering all those good practices we used in our facilities during the pandemic in terms of cleaning surfaces frequently and good hand hygiene practices. And so just remind you of all of those things and wish you all health and happiness over the next several months. Thank you.
Thank you so much, Stephanie. Patty?
Yeah, again, thank you so much for having this panel. This has been amazing. And I look forward to seeing everybody at the show next week. Let's hope everyone's there. And I'll be walking the floor, so please grab me if you see me, and would love to talk to people and learn more about what your needs are. As we head into the winter months, and we don't know what the cycle of COVID will be in the future, but it's going to be here with us to stay. But flu has been here with us for many, many, many years. And we know that flu season happens, starting right now and going into the spring. I can't elaborate even more really on what Stephanie just said. We really need to pay attention to our behaviors. And as facility owners, we need to pay attention to what we're doing from a scalable response. If you're seeing your numbers and absentee rates start going up, then you need to step back and look at the frequency that you're cleaning, what your indoor air quality is looking like, And also, is your staff properly trained? And not just the front lines, but have you addressed infection disease awareness in your workforce? Because it's not just the people who clean the surfaces, it's the school teachers, and it's the office workers, and it's the people who are visiting. That's really important. We all need to become more aware of how we can break that chain of infection.
Thank you so much, Patty. And Jordan?
Yeah, thanks again so much for putting this panel together. I'm so excited that I was able to participate and to represent Clorox Professional, talking today about cold and flu and some of the things that are coming and some things that we can do. I look forward to kind of seeing how things go with the cold and flu season. I hope that you feel from this discussion today, I appreciate all the comments that were made, that you feel like you're in a better position, that you're more prepared, and that you have a plan moving forward. If you have any questions or looking for additional resources, please feel free to reach out. That being said, we know that, like was mentioned, this flu season might be a doozy, and that we could see some things that we hope not to, but we can, as we look back to the basics, those things that we talk about, our hand hygiene or surface disinfection. Education is a huge thing. Making sure that we're doing these small things, I think, can make a big impact on what we're seeing and can keep our workplaces, our schools, our healthcare facilities safe and in the best position to be prepared for whatever comes our way.
Thank you so much, Jordan. And I would just like to thank everybody for joining us today for this informative session full of great questions and answers from our expert panel. Thank you so much to Jordan, Stephanie, and to Patty for being here. This discussion will be uploaded to our YouTube channel later on today, and will be available to watch and share with your teams. And we hope you enjoyed this as much as we did. Thank you so much for being here.
Thank you.
Thank you.
Thank you.
Thank you.